Hello, I'm Jennifer Stelfox, Doctor of Veterinary Medicine and Certified Canine Rehabilitation Therapist. Today we will be discussing active therapeutic exercises. An exercise is considered to be active when it requires muscle contraction by the pet itself. The handler is only there to provide guidance. Muscle contraction is essential in building muscle mass, and strong muscles go a long ways to stabilize and protect a pet's arthritic joint. So let's help our pets develop some very strong muscles. When performing these active therapeutic exercises, it is very important that they be done slowly and precisely. Today's exercises are considered to be basic and are appropriate for pets with arthritis or for any pet that will benefit from increased muscle and tendon strength. Once again, cold muscles do not move very well, and it is important to take the pet out for a 3 to 4 minute walk, massage the muscles, or apply heat. This exercise is called the withdrawal reflex. It requires the dog to pull back its paw, both as a reflex and also as a voluntary movement. It is performed by tickling or running our fingers between the toes. This causes the dog to contract the muscles of the leg and pull the leg upwards and forwards. This then can be repeated on the back paws for a similar effect. These exercises cause the muscles to work without having the joints bear any weight, which is perfect for some arthritic dogs. A great exercise for the front paws involves asking the dog to give a paw. When I ask Amy to give her paw, I often need a treat to reward this behavior. She contracts her upper and lower arm muscles as she lifts her paw into my hand. She is using her muscles without weight bearing on this limb. I can make this exercise a bit more difficult by raising my hand higher or moving it further away from her to make her flex and extend her limb even more. I can also present the palm of my hand and have her give a high five. Weight transfers can take several forms and can go from easy to more difficult. The easiest is to have the pet stand up and gently push the hips from the left to the right to shift the weight from side to side without having to lift either leg. For dogs with severe arthritis, you may only be able to do a couple of weight transfers before they are too fatigued. Remember, always respect the dog's capabilities and never do an exercise past fatigue. The next level of weight transfer is to push the pet's hips with enough force to make them step to the side and then have them step back in the opposite direction. Once the pet is able to perform the hip sways, the dog can then move up to three-legged stands. This causes all the weight to be carried by the opposing leg. Alternating from lifting the left to the right legs results in weight transfers. Weight transfer exercises are also easy to do on cats. It is easy to get them to shift their weight from left to right and have them react and readjust. A useful tool for this is a small board. In this case, I use a wobble board. Just put the kitty's hind legs on the board and gently shift their weight from side to side. This works the front legs out very nicely. The next few exercises require standing, and it is very important to have the pet on a non-slip surface such as rugs, yoga mats, grass, or a non-slip floor. A very good exercise for working a dog's hind legs is to have him rise from a sit to a stand position. Treats are often required for this exercise. Sits to stands are great for working out the quadricep muscles, similar to us doing squats. It is important to do this slowly and with control. Make sure that the dog is sitting straight with her knees bent. Dogs with arthritis in one of their knees will often cheat during this exercise by allowing their weaker leg to stick out to the side as they stand up. As you see, Amy attempts to do this as her right knee is arthritic. There are two ways to keep them from cheating. Standing behind the dog, brace your feet immediately to the outside of her paws, and this will prevent the weak leg from sticking out to the side. The second way is to have the dog sit with the weaker leg up against the wall. This will make her weight bear on this leg as she rises. Start with just a couple of sits to stands to begin with, and slowly increase the number as the dog's muscles strengthen over time. Most elderly pets have arthritis in their spines, and it is extremely important to keep their spines moving well in all directions. Cookie stretches and cone bending are two of the best ways to achieve this. Cookie stretches are great for the neck and the upper spine. My favorite type of cookie is a dehydrated liver treat, as you can break them into extremely small pieces and give them as a reward, and their pets just love them. First, we will work on the neck. To get the pet to bend its neck to the side, hold a cookie in front of their nose. Then touch the cookie to their left shoulder, and then repeat to the right shoulder. To bend the head upwards, lift your hand with the cookie up towards the ceiling. Then take the cookie to their chest to bend their neck downwards, and for an even deeper neck stretch, take the cookie to the floor. This will also help bend the upper back. Next, we work the upper and the mid back. Take the cookie in front of the nose and move it all the way back to the pet's hip on the left side. The pet will bend its upper spine to get that cookie. Now move the cookie to the right hip. In order to bend the spine upwards, you can place the dog's front legs up on a step and then lift the cookie up towards the ceiling. This is also a good strengthening exercise for the back leg. Cone bending is another great way to get the spine to move. Start with 3 to 4 cones, and if you don't have cones, pop bottles work just fine. Each place the length of the dog's body apart. Have the dog do S-bends around the cones, thus bending their spine from side to side. When they get really good at it, the cones can be moved closer together. And finally, one of the best active therapeutic exercises you can get your pet to do is the simple activity of walking. Walking helps build muscle mass and keeps the joints nice and mobile and is extremely easy on the pet's joints. So let's give it a try. I encourage you to keep the pet motivated through its rehabilitation program. Lots of praise and small amounts of a low-calorie treat go a long ways to help them encourage the rehabilitation program. I encourage you to work with your veterinary team to help your pet become the best it can be. Thanks for watching.